Before we begin, when was the last time you had your eyes fully examined? Not just a prescription. Check a full retinal examination where a doctor looked at the back of your eye and assessed the health of the tissue doing the actual seeing. Vision loss doesn't arrive suddenly for most people. It retreats. It's the gradual realization that you need more light to read than you used to. The slight difficulty distinguishing contrast in dim conditions. The moment you notice that the edges of your visual field aren't quite as sharp as they were 5 years ago. Most people chalk these changes up to aging, because most don't know that the specific biological processes driving these changes are not completely reversible once advanced, but significantly modifiable through daily dietary choices that most eye health conversations never reach. I want to tell you about a patient I'll call Margaret, 73, a retired school teacher who had read voraciously her entire life. 18 months before she came to see me, she'd been diagnosed with early AMD and told to return in a year to monitor it. No guidance about what she could do in the meantime. She sat across from me and said, "I feel like I'm just waiting to lose my sight, and nobody has told me if there's anything I can actually do." We'll come back to Margaret, because what happened 12 weeks after she changed. One thing in her evening routine is something everyone reading this deserves to hear. The fruit I'm about to describe has the most complete package of retinal protection compounds of any single fruit studied in eye health research. The research on why bedtime is the optimal consumption window has a biological explanation that changes how this conversation is usually framed. Don't skip ahead when I name it. Your first reaction will almost certainly be, "I already know about that." You don't know what I'm about to tell you. The American Academy of Ophthalmology and the National Institute have both been explicit about nutrition's central role in eye disease, specifically about the retina, as the tissue where antioxidants make their most measurable and clinically significant difference. This is not alternative medicine. It is the conclusion of decades of peer-reviewed research, including one of the most significant nutritional intervention trials in ophthalmology history. To understand why the right fruit makes a documented difference, you need to understand what is happening inside the retina as it ages. The macula, responsible for fine detailed vision, reading, and face recognition, is among the most metabolically active tissues in the human body. Its photoreceptor cells generate reactive oxygen species that damage cell membranes, DNA, and function progressively over decades. As antioxidant defenses decline with age, this oxidative damage becomes the primary driver of AMD. The second mechanism is chronic retinal inflammation, the same pro-inflammatory cytokine cascade that drives joint destruction and arthritis accelerates photoreceptor degeneration. The third is glycation glucose molecules binding to crystalline proteins of the lens, producing progressive clouding. The fourth, most specifically modifiable, is the decline of macular pigment density. The macula is protected by a layer of yellow pigment composed primarily of lutein and Zeaxanthin. This pigment absorbs short-wavelength blue light before it reaches the and acts as a direct antioxidant within the photoreceptor layer. Macular pigment density is the single most modifiable predictor of AMD risk. The Retinal trial confirmed that adequate dietary zeaxanthin, alongside lutein, is associated with meaningful reduction in AMD progression risk, and that macular pigment optical density can be measurably increased through consistent dietary intervention over 8 to 12 weeks. Before naming the fruit, blueberries have documented effects on retinal blood flow through anthocyanins. Genuine, but the zeaxanthin content is low, the anti-glycation mechanism absent, and research on blueberries and macular pigment shows modest effects. Carrots deliver beta-carotene that converts to vitamin A and supports rhodopsin for low-light vision. But in the well-nourished adult over 60, vitamin A deficiency is almost certainly not driving vision decline. Carrots address the right organ with the wrong mechanism. What I'm about to describe addresses all four mechanisms simultaneously through a single fruit consumed at the optimal biological moment. The fruit is papaya. Mechanism 1. Macular pigment density support through Z. Think of macular pigment like the tinted visor on a welding helmet, filtering the specific way that would damage the eyes while allowing functional vision to continue. When density falls, the photoreceptors beneath are progressively exposed to blue spectrum light and oxidative stress. Zeaxanthin in papaya is a compound the body actively concentrates in macular tissue following absorption. Mechanism 2. Aqueous humor antioxidant support through vitamin C. The aqueous humor contains vitamin C at concentrations 20 to 30 times higher than blood plasma. The eye concentrates it there as the primary antioxidant defense, protecting lens epithelial cells from the oxidative damage that initiates cataract formation. When those concentrations fall, oxidative threats accumulate at the lens surface. 1 cup of ripe papaya delivers over 90 milligrams of bioavailable vitamin C, enough to replenish these critical anterior segment levels. Mechanism 3. Anti-glycation lens protection through papaya. This is the mechanism no other commonly discussed eye health fruit can reach. Glycation is the attachment of glucose molecules to crystalline proteins that maintain lens transparency. As these bonds accumulate over decades, the proteins clump together and produce progressive clouding. Think of the lens like a perfectly clear window. Glycation is a fine film over years, not visible at first, then a slight haze, then cloudiness bonded into the glass itself. Papain, unique to papaya, directly inhibits the glycation of crystalline proteins. Mechanism for retinal anti-inflammatory protection through lycopene and Bedtime. The chronic low-grade retinal inflammation driving AMD progression accelerates photoreceptor degeneration beyond what oxidative stress alone produces. Both lycopene and beta-cryptoxanthin, present in significant concentrations in deeply orange ripe papaya, inhibit NF-κB pathway activation in retinal pigment epithelial cells. Think of retinal inflammation like a slow, sustained heat source degrading your most delicate instruments at a rate that becomes visible only over years. The protocol: 1 cup of deeply orange ripe papaya, 60 to 90 minutes before sleep, paired with 4 to 5 walnuts and a squeeze of fresh lime juice. The bedtime timing is not arbitrary. The retina performs its most intensive repair during sleep, specifically the disc shedding and photoreceptor renewal managed by the retinal pigment epithelium overnight. Consuming zeaxanthin, vitamin C, and lycopene before sleep allows peak absorption to align with the early sleep window, when retinal regenerative processes are most active. Ripeness is the dosing guide. Deeply orange ripe papaya delivers significantly higher zeaxanthin and beta-cryptoxanthin than pale underripe fruit. Leave pale papaya at room temperature for 2 to 3 days. Do not refrigerate during ripening. Fat pairing is mandatory. Without dietary fat present, a significant proportion of these fat-soluble carotenoids passes through unabsorbed. Research shows fat co-consumption increases carotenoid bioavailability by 50 to 100%. The walnuts are the delivery mechanism and independently deliver omega-3 fatty acids that support retinal membrane health. On days when fresh papaya isn't available, golden kiwi, 2 daily with the skin, delivers high vitamin C alongside lutein, the macular pigment companion, to papayas. Dried goji berries, 1 to 2 tablespoons rehydrated in warm water. Pitted wheat fat contain among the highest zeaxanthin concentrations of any food source gram for gram. Research in JAMA. Ophthalmology documented measurable macular pigment optical density increases in adults who consumed goji berries daily for 90 days. The 5 rules determine whether this protocol produces results. First, ripe, deeply orange papaya only. Color is the dosing indicator. Second, always pair with fat. Without it, the carotenoids are not absorbed. Third, request macular pigment optical density testing, not just visual acuity. A person can have perfect 20/20 vision and significantly depleted macular pigment simultaneously. Establish a baseline, then retest after 12 weeks. Fourth, 8 to 12 weeks of consistency. Macular pigment accumulates over months. Fifth, protect what the papaya builds with warm screen, settings after sunset, and UV sunglasses on sunny days. Margaret implemented this protocol for 12 weeks. 1 cup of deeply orange ripe papaya, 60 to 90 minutes before bed. For walnuts, a squeeze of lime. At air 12-week follow-up, her macular pigment optical density had increased measurably. Her ophthalmologist asked what she had changed. When she described the protocol, it took notes. She told me afterward, the most important thing wasn't the number. It was knowing I was doing something. Not just waiting. That is what I want for you. Not the passive experience of watching something decline while hoping it doesn't get worse, but the specifics. Grounded, evidence-informed daily action of a person who understands what their retina needs and is consistently providing it. 1 cup of ripe papaya, 4 walnuts, a squeeze of lime, 60 to 90 minutes before sleep. Starting tonight.